So, is the Health Secretary a drug dealer? Therese Coffey, that peak specimen of healthy living, reckons one way to alleviate pressures on doctors is to share antibiotics, as she has done so herself from her own private stash. I mean, where the hell do you even begin with this? Despair, firstly, that this cretin has been put in charge of health, another ill-suited position for another Tory on the gravy train. It's unbelievably dangerous advice to give to people. I know you style yourself Doctor Therese Coffey, but you're a doctor of chemistry, not medicine. What next? Is she going to recommend people having heart attacks stick their fingers in plug sockets to reboot their ailing bodies so as not to bother our overrun ambulance services? Or perhaps she'll recommend JCB pliers over Black & Decker for pulling your own teeth when you can't get a dentist. Not because they're any better, but because it sends some business away of one of her party's biggest donors. That woman must have antifreeze for blood, the way she repeatedly demonstrates in every ministerial role she's had, that she could not care less if it is run properly, runs in the interests of those she oversees, or even if she's in possession of all of the facts. Well, let me spell some out for you, Therese. Passing on prescription drugs is a criminal offence. You've admitted to breaking the law, so resign. If you have a stash of leftover antibiotics, then you haven't been taking them properly, have ignored instructions given and doctor's advice handed to you. You always finish the course, even when you're feeling better, where drug resistance can build up. Resistance to antibiotics is one of the biggest global crises in medicine to this day. Drugs manufacturers have failed to research new ones for so long because there's little money in them, that for many bugs, they are becoming less and less effective. As a result of this, doctors are more and more strict regarding the prescribing of these drugs, but you incompetent balloon, want to allow chemists to be able to dispense them even more easily, which will only result in an efficacy ticking time bomb as people take them and no doubt share them on your advice, even when they are not the best course of action. Therese Coffey is even less suited to the health brief than Liz Truss is to running the country. Just go before people die because of you.